hosts or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. Welcome to Ageless Health Livestream. I'm Dr. Tom Roselle, and I've got a great piece of data for you today, one that you really need to think through. How many of you have reached a place in your world where, you go to the doc and you feel like you're washed out, you're burned out, there's nothing left, your brain doesn't work the way it's supposed to, sexual function has gone down the tubes, your fight-flight reaction is in overdrive, and you crashed on the curb a while back to go, I'm going to put some pieces of the puzzle together for you, because this is really important to understand. And the sooner that you understand this, the more likely it is that you can fix it, that you can resolve the problem before it gets to a place where you may not have enough time to resolve it. And this is really important when we talk about any condition, any situation. We're talking about the process that we think is the result of just getting older. The doctor says, well, what do you expect for your age? And if you heard me on platform, you're always going to know that what I expect for my age is the ability to continue the process and get stronger and better over the years, not just depleted and sit back and, become, this couch potato that doesn't have the energy to do anything. This is one piece, a big piece of that puzzle, understanding what happens over time. Your genetic map, if we look at you and we begin to put you together, we can recognize you as you, right? You're male, you're female, you have different things that make that happen. But they're broken down into systems. You have a nervous system, you have a cardiovascular system, you have a pulmonary system, you have a hepatic system, you have a renal system, and so forth. And those systems break down even further. They go into tissues, right? Cardiovascular tissue, you have muscular tissue and the like. Then we go further and then we look at molecules and cells, and then we look at atoms and the components of the atoms. And then we go down into the next component, the last one, which is an energetic platform. It's a photon, it's a wavelength. And that's the creative substance of everything that exists on the planet. But we're going to back it up a little bit. We're going to talk about the chemistry within that human physiology called you. And this is what you need to really understand. You got to get it before you understand that there's, a drug isn't going to fix it. First, I want you to understand that, what happens, and then I want you to get what you might be able to do about it in combination. But we're going to talk about one substance today, and it's called tyrosine. But first you have to understand that tyrosine is an essential amino acid in multiple systems within the body. It works in the thyroid, it works in the adrenal glands, it works in neurotransmission, it works in the intestinal system, produce your neurotransmitters, because that's where the majority of your neurotransmitters are produced. So here's the deal, and here's the observation. Is seemingly as we get older, and not necessarily older, but as time passes, and it could that time passing could be your 30s, it could be your 50s, it could be 70s or 80s. We seem to lose the drive, the ability to function. We start seeing more and more thyroid problems. We start seeing hair losses. We start seeing loss of libido. We start seeing your heart starting to flip around and misfire, and we get these AFib problems, and we lose cardiac output. Could there be a singular strain, a thing that if we finger point to it says this is what's causing it? Possibly. It could be something that we're talking about is L-tyrosine, and as we stress out over a period of years, tyrosine begins to deplete itself, and that's not okay because it works in so many different places. So let's tell you where it works in basic patterns, and I'm going to tie in all the pieces. Tyrosine is an essential amino acid that in the thyroid gland, when it's combined with iodine and trace minerals, produces T4, which is thyroxine. So thyroxine is the primary active hormone it's not the active hormone, it's the primary hormone that the thyroid produces. Then it's converted in the liver to T3. The thyroid will produce a little bit of T3, about 20%. But without tyrosine, you can't have a healthy thyroid, and the thyroid becomes very unable, if you will, to do the job that it's supposed to be doing. And it's a major driver relative to all kinds of things, as you know, if you have a thyroid problem over a period of time. So we want to talk about what happens when that system is overstressed, because if it's overstressed, you got a problem. And here's what we're talking about. Tyrosine also works inside the adrenal glands, in the adrenal medulla, and that's the center portion. So if you take your kidneys, and on top of that, there's a little cap. That's called your adrenal glands. And it squeezes out all kinds of things. It has an outer shell. It's called the adrenal cortex. It has an inner portion, and it's called the adrenal medulla. The adrenal medulla produces three primary pieces of hormone triggers. One is norepinephrine, epinephrine, and then something called catecholamines. And these are the guys that trigger other pathways in your body. Years ago, when we put together the norepinephrine, epinephrine pathways, we used to call it as a group adrenaline, but it has modulating effects on blood pressure. It has modulating effects on how the heart works. It gives you a little bit of that oomph relative to other pathways. And catecholamines help begin to produce other aspects of hormonal function and things that will serve the brain and so forth. We're becoming very general right now. In other programs, I'll get into those. But we're talking about tyrosine. Tyrosine is essential for the adrenal medulla. Now, here's a piece that I want to string together. You remember, in my world of diagnostic muscle testing, integrative therapeutics, every muscle in the body has an organ system that it communicates with. So you have your brain, spinal cord. You have 31 pairs of nerves that come off the cord. They divide. One branch facilitates the function, the activity of the internal mechanism, your organ systems. The other one goes to a muscle that connects with it. So you have muscle organs talking to each other. That's, in the back of the day, called visceral, inside, somatic, outside reflexes. So if the inside of the body is not working the way it's supposed to, the outside of the body is not going to function normally either. Now, in this adrenal medulla, this inside portion of the adrenal system, it affects the muscular pattern, a muscle that comes from the front of the hip, and it's about that wide and about that long. It's actually the longest muscle in your body, and goes down and goes to the inside of the knee. What it does is it keeps your knee stable and keeps your hip forward in a locked position. If that's not working the way it's supposed to, you've got sacroiliac pain, you've got knee pain, you have the predisposition of injury. But we'll get to that perhaps a little bit later, but I want you to keep that in mind. That's how important this piece is. But also, heart dysregulation begins to occur. Your heart starts jumping around if there's not enough tyrosine. Now, before that occurs, there's other systems that are being depleted. And one of them is the thyroid, as we mentioned before. Another piece, if there's not enough tyrosine, you begin to lose the ability to have interest and sustain drive. And that comes from something called dopamine. That's your feel-good juice. That's your motivation juice. But tyrosine is necessary in the pathway, along with phenylalanine, to be able to produce that substance. Now, what does that have to do with getting older? You might ask. I hope you're asking that question, because here's what happens. As we get older and we begin to not pay attention to ourselves, we start drawing on that fight-flight system, the adrenal system, to keep us going. And it begins to need more and more tyrosine. So if you only have a limited amount of tyrosine, you start seeing symptoms that seemingly are unrelated, like loss of interest, motivation goes away, all the symptoms that go along with thyroid function, night sweats, if you will, you're cold all the time, you got weight that you can't put on, you begin to lose your hair. All those things can be related to that substance. Now, the other piece is that, those guys like me that get gray pretty early, mine was genetic, but tyrosine, when it's depleted, will cause that to occur. So now you see people go through their years and they start having these symptoms. I don't have the interest anymore. Oh, what do you expect for your age? You're getting older. And most people end up that way. Yeah, a lot of people end up that way. It's not uncommon. It's just not normal. So when we have to look at those things, something that is possible, but not necessarily needs to be probable, has to be looked at in a very different light. And in this situation, when we're talking about tyrosine, it's really critical that we understand the pathways. And that's what I want to get into, and talk to you a little bit more about. It's an amino acid that is one of the building blocks of a lot of different proteins in the body as well. It's involved in structural balance and processing and regenerative tissue. So let's say if you have injury, for your body to heal properly, it has to have some tyrosine. We said it's a precursor to the neurotransmitters called epinephrine, norepinephrine, and we did mention dopamine. Now, there's another one. Interestingly enough, and I didn't know this to a few years ago, how critically important it is. People who have vitiligo, where they're losing pigment in their skin, and it happens to a lot of people. It seems to be serendipitously as they get older, but it can happen in a very young group of people as well. And so you have these big blotches of loss of pigmentation. But what seems to be part of the commonality of it is the low levels of tyrosine. And what happens is there's an underlying mold that occurs that begins to destroy the melanin or melanocytes, the cells that produce pigment within the system. So if you give high enough levels of tyrosine with a couple other cofactors, in my clinical experience over the years, all of a sudden we see people begin to see pigment return. And we have before and afters of that really are amazing. And you say, how did that happen? And you get out there and you see all these other drugs, and they just don't work. They actually cause other problems as well. It helps the pituitary gland. The anterior portion of the pituitary, as we talked about, produces TSH, or thyroid stimulating hormone. It also produces LH, luteinizing hormone, and FSH, follicle stimulating hormone, and ACTH, adrenal cortical stimulating hormone. Now, these guys are super important, because if that anterior pituitary is not working the way it's supposed to, libido is going to go down the tubes. Guys, you're going to suffer from ED. Ladies, you're going to have no drive whatsoever. And all of those things are important when you're evaluating. You have to know the background. You have to know what's taking place, but you have to know how to identify what's really taking place. Now, you have to be careful with supplementation with tyrosine. It has to be done on an individual basis, and it should be, followed through with somebody who really understands it and understands the cofactors that are necessary for its transport and so forth. But tyrosine is incredibly important and has been shown in the literature. You go to PubMed, you go to Townsend Newsletter, you go to those types of great medical resources, and tyrosine is important and critical for brain health and stress reduction, improved cognitive function, and as we talked about, those other things as well. So just because we're getting older doesn't mean that we have to suffer mental depletion, that we don't remember things, that we don't act as quickly, that we can't follow commands the way that we should be. There's a reason for that. And if we don't ask the question, why is that, and we start taking medications supposedly that help this, we're going to be in a problem. But we're noticing that if we can identify the problem, as we can with the type of work that we do in our practice, through not only through neuromuscle function response testing, but also with sensitivity testing and blood work and so forth, now we can increase cognitive performance. And we have the validation before and after. We do some interesting blood testing. It's just a finger prick, by the way, that'll give us a lot of different levels. But when stress is significant, and you can mark it, and you give enough tyrosine in balance with other things, all of a sudden, what you're seeing is a resolution of the physical manifestations of chronic increased stress pattern. When you can't sleep and you just you're waking up, the middle of the night and so forth. Remember, if you've heard me lecture before, you've heard that can be one of a couple things. It could be cortisol spike because your blood sugar is dropping. If cortisol goes up, that's what wakes you up in the morning and says it's time to get up, get moving, and feed your body. But it can happen in the middle of the night, particularly if at nighttime you don't get enough protein. So remember I said early on, tyrosine is necessary for protein synthesis within the body. really important that if this thing is depleted, and that's your adrenal system, your fight-flight system, that you're going to start showing a lot of these other things. Now, during the periods of prolonged stress, the body starts releasing these other substances that I talked about called catecholamines. And with that stress continues, it depletes it significantly. And your tyrosine level starts going down the tubes, and you start noticing that you can't handle exposures to extremes, particularly cold. And guys that are in the military, and this is where one of the biggest studies came from, that PTSD pattern that they have, and it's a depletion of other types of neurochemical transmitters, but this one specifically. And when they give enough tyrosine in balance with other things, cognitive functioning dramatically improves. The switching in workloads and memory becomes stronger. It's really interesting when you really start looking at it. See, the problem that we have is we don't ask the right questions of our doctors. And unfortunately, there's so many of them that if you did ask them, what's the importance of tyrosine within the system, they're not going to be able to give you a cogent answer. So ask them this sometime. Hey, doc, what is PKU? And what happens in the body? And, so forth. So here's the deal. Phenylalanine, as we talked about before, converts into tyrosine. And if you don't have enough of that substance, you're not going to produce tyrosine. You can't get it done. So it's important that your doctor and you understand what the piece is. So are there side effects from tyrosine? We're going to get, before we get into a little bit more, that's what you should be asking. Tyrosine is recognized, and we call it GRAS, G-R-A-S in capital letters. It means it's safe by the FDA. And as a supplement, tyrosine is mostly safe, except if it's a prolonged supplementation over a long period of time. The dosage that they use are 150 milligrams per kilogram of body weight. So if you want to know what that means, take your weight, divide it by 2.2. That's the kilogram level. Multiply that by 150. And that's the amount of milligrams in tyrosine that you have to just keep yourself the way you need to be. There's been reports of some nausea and some fatigue in the initial phases of it, a little bit of a headache. So remember this, less is always better with any supplementation in the initial phases. Now, you have to be aware of some precautions as well. Understand, according to the medical literature, they're going to say that there's not enough data over the safety and prolonged use of tyrosine, particularly in breastfeeding women. So sticking to low amounts of tyrosine, specifically as they are derived from foods, is probably better, or maybe 100 milligrams to 500 milligrams of tyrosine. Not going to be a problem. I haven't seen, in 47 years of practice, I haven't seen any, distortions of or compromise or side events of that. People with thyroid disorders should avoid taking tyrosine until you understand what the balance is. Tyrosine may increase thyroxine levels, that's your T4, ultimately making hyperthyroidism or Graves' disease worse. So here's the correlation. Does it work in the thyroid? Absolutely. But if you're already producing too much and you're not knowing, or you're producing, middle to above levels of where it is, why would you want to make that different? You want to make sure that the T4 thyroxine is converting into the active hormone of T3, and then that T3 is brought into the receptor site so it can be used by the body. So it's not every situation to fix a thyroid problem that you need tyrosine. So we have to be careful. We have to run the blood work. We have to understand, and we have to make sure that the nervous system, if you will, is working properly, the energetic receptor within the cell. That's why I started out earlier in the program, and I talked about the energetic platform, the photon, the wavelength, and so forth. If those guys are depleted, that's your acupuncture. If the expression of the nervous system, brain, spinal cord, 31 pairs of nerves aren't working the way they're supposed to, they're being held back because there's a pinch or stretch in the nerve, then you have to turn those guys on first. You have to make a difference before you can begin to supplement anything, in my opinion. And that's what I've noticed over all the years. So we have to make sure that we understand that this can be a very miraculous substance, and the results are over time. The amount that you take for your particular situation has to be evaluated. The cofactors have to be brought in, but you have to make sure that there's not other things that it might exacerbate, like a Graves pattern. Now, there are medications that if you're taking them, you have to be very careful with when it comes to tyrosine. Levodopa is one of them, and it's a medication used in Parkinson's disease. Why? Because here's what happens is that the tyrosine is going to increase dopamine, which is the same family that we're talking about here. So we have to be careful relative to absorption, because tyrosine will compete within the intestinal tract for the absorption of levodopa, or L-dopa as it's often called. So if you're a Parkinson's patient, it may be useful, but it has to be very carefully applied. So you need to talk to somebody, that's doing that. Now, here's an interesting thing that came out in some of the literature, and I was really surprised when I saw it, but we've noticed it kind of anecdotally and clinically over a period of years, is that a lot of you are taking what's called an MAOI blood pressure medication, and combined with high tyramine foods can increase blood pressure to dangerous levels. Tyrosine is broken down to tyramine, so you have to be really careful. If supplementing tyrosine would increase tyramine levels, then it says, you got to be careful, right? So you really need to understand that. But in some patients, that tyrosine will help regulate the blood pressure as well. So we have to, understand those things. Now, there are foods that I want you to know about that you can eat enough of. And some of you are so protein depleted that, we really have to go after that first before anything else. Meats and fish and dairy products, clean dairy, free-range, organic, raw, grass-fed animals, and so forth, and not cows, by the way. Get it from sheep or goat. Why? Because they're the closest to mother's milk you can get. Eggs, again, free-range and so forth. Avocado, wheat. You go to some of the sites and you're going to see that soy is good. Do not do soy. It's a hormone disruptor. It causes hormones to be degraded and not used properly, and increases others like estrogens that you don't need. So tyrosine supplementation can be found in many different platforms. We want to make sure that it's the right form. We want to make sure that it's doing what it's supposed to be doing. Tyrosine is a non-essential amino acid. What does that mean to you? Well, it means that it's produced in the body. It's also easily available from many types of foods. But if you're not getting the right foods, if you don't have the other cofactors to produce it, then it's not going to work. So you have to make sure you understand that and act accordingly. So let's talk about tyrosine in a couple of different pathways, which is important. We said tyrosine, L-tyrosine, or tyrosine, as it's commonly called, is one of the 20 standard amino acids that are used by the cells to synthesize protein. And, it's a non-essential amino acid. And what basically is what we're talking about is that, do you need tyrosine to make proteins? Short answer is yes. What do you need proteins for? Lots of stuff, but also muscle building and muscle improvement. So as we get older, we see people wasting, relative to their muscles. They get flabby, they can't build muscle, they can't tone it up. It could be a tyrosine depletion. Now, if that's the case, once you get the inflammation down, then tyrosine may help. Once you get the nervous system to work, tyrosine may make a huge difference. So we have to understand that there's a lot of pieces of this puzzle. I did a lecture the other night, a group of about 40 doctors online, and I co-teach with another doctor out of Boston, Dr. David Leaf, who I consider an amazing, brilliant human being. And he was the doc for the old Boston Patriots many years ago. He was the head doc for AC Milan and so forth. We were talking about a lot of different pieces of this puzzle, but understand that as people age, they lose their motivation. And so it's one of the things that allows an older athlete to stop is because that motivation begins to drop down. Every once in a while, you see somebody that, oh my God, they're crazy at their age. No, they just have a really good motivation and they have enough of the right amount of amino acids, including particularly tyrosine, that allows them to do what they need to get done. Now, we've had patients that have come in and we've treated them for thyroid problems back in the day, and they tested for tyrosine, and we did all the other things we did. And they said, "Hey, doc," he said, "I don't know, is this thyroid problem that I'm starting to feel like I want to do things again?" He said, "Yeah, possibly." He said, "No, but I mean, I really enjoy working out again," and that started triggering my interest about what really is happening. Physiological factors, what we're talking about right now, we can term them as passion and grit. And, let's talk about people over 50, for example. But they often exhibit less grit, or what we call willpower, if you want to put it that way, motivation, not wanting to do stuff, go sitting in the chair, don't have the interest that we used to. So it's the old thing, use it or lose it. Well, even if you use it, you're going to lose it just as rapidly because you don't have the substrates to be able to take care of what needs to be taken care of. It's important that you understand that. Let's go to a common problem. We're talking about your thyroid again. So within the thyroid, it's called the follicular cells of the thyroid. L-tyrosine causes the production of thyroid hormones. And the enzyme TPO, thyroid peroxidase, if you will, antibodies, catalyzes the addition of iodine, because you remember I said earlier, you need iodine, you need trace minerals, you need tyrosine to produce what needs to be produced. And the residuals of a large protein, by the way, it's called a glycoprotein. It's another name for it is a thyroid globulin. If you look it up, you'll find it that way. It's important to be able to have that mechanism work well. But too much of it, then you go the other way. Then you end up with an immunological reaction called Hashimoto's, and we have to be careful with that. But it will work, and it really makes a huge, huge, huge difference when you want to fix somebody. Let's talk another piece of the benefits of tyrosine and what happens if you don't have enough of it. So when we talk about, tyrosine, I touched upon cognitive performance. L-tyrosine, as we said, improves mental performance under stressful situations. There was a huge study done with military guys out in the field when they were under combat, and they were under a huge amount of stress because, they may get shot and die, or they may lose a limb. Tyrosine helped improve mental performance and decision-making processes at the time of stress. So the research suggests that L-tyrosine supplementation can enhance cognitive flexibility, if you will, the ability to adapt and move and change and make decisions when people are under stress. If it doesn't necessarily improve memory under normal conditions, like everything's cool and so forth. You're not going to see this up spike of memory retention, but under stress conditions where you're burning up all this other stuff in your body, tyrosine seems to have a very, very important role in application. So understand that we get into multiple levels of this. We can talk about this for quite some time and give you a lot of different pieces of the puzzle. But I want you to get that as we get older, neurocognitive effects of tyrosine depletion has this catch-22 and repetitive stress cycle. As we go under stress, we deplete tyrosine, we deplete tyrosine, we deplete dopamine. When we deplete dopamine, we go under a place of losing our ability. Now, let's go back, and I want to kind of leave us with this thought process. Patients like Parkinsonian patients who lose their capacity first to walk and move and facial expressions and so forth, it's because scientists have found that it's often partially a result of low levels of dopamine, L-DOPA. It's what they use to fix it. Now, it doesn't really do a great job across the board because it's not the only piece of the puzzle. We know that Parkinson's is a result of something that's affecting the lower portion of the brain called the cerebellum. And if the cerebellum is not working, your memory to do things, your capacity to do intentional processing physically begins to become retarded. The idea with that is to use L-DOPA, but there's a lot of side effects, and that's not the purpose of what I want to talk to you about today. So you have to understand that if you use the right amino acids and you normalize the cognitive function, you get rid of the things that are blocking it. It could very well be heavy metals. It could be vaccines that have been put in place for, over many, many years. We are the generation that they started up-ramping all those things. There may be a way of resolving some of this if you look at it multidimensionally. That's upregulating the nervous system. It's allowing things to be received in those receptors, that hand in glove process that we talked about early, and really looking at what happens under stress with depletion. See, now I want to go back to the original state. You have tyrosine, and even if you're getting it through your diet, but you're under a stress pattern that is persistent over a long period of time. What's stress? Pain, persistent, doesn't go away. What's stress? Stressful emotional situations that you live in constantly that you're unwilling to do anything about. What's stress? Eating the wrong things that you should be going in your body or anybody else, or poison. If you look overseas, meaning Europe and Australia and Netherlands, do you know how much of U.S. foods are banned in those countries because they're carcinogenic and they're neurogenic, degenerating and so forth? Take a look at those things, my friends, and then ask yourself the question, how much of those are you actually getting in your body? My guess would be that it's not so good. We're going to have a program. We're going to talk about hormone dysregulation and what happens because of the things that we're exposed to, and why so many people are losing their drive, their capacity, their sexual prowess, and so forth, and other situations as well. But that's not a program for today. I want you to know that if you want some more information, you go to drtomroselle.com, and we're going to start posting some data there. And by the way, all of our live stream programs are posted and available through drtomroselle.com. And if you want to know about tyrosine and so forth, obviously the doctors at the Roselle Center in Fairfax, Virginia, are very, very attuned to this. And we want you to make sure that you do it the right way and you have the tools to make things happen. Be real careful when you go online and say, oh my gosh, he said this, I'm going to take this. That's not what I'm saying. What I'm saying is that these things can be extremely beneficial, providing that we go through the process of evaluation and we know that's what it is. In addition to that, remember what I said early on? Start out with anything you do. Less is always better, and pure samplings is far better than anything else because you can cause other problems as a result of it. I hope you got a little bit of insight in what happens as time goes on in our world. And please understand that I want you to have the data, and I want you to get to the place where you understand that life is really what you make of it, meaning that you have control, but control comes with education and knowledge. And the more education and knowledge that you have, the better questions that you can have, and the better questions, the better life, and you can move forward and really plan to live a whole lot longer than maybe somebody told you. Having said that, my friends, remember one thing. I love you all. See you next week. you.